How quickly do side effects from this diabetes medication typically appear? Most patients experience Ozempic side effects within the first week of starting treatment or following a dose increase, with gastrointestinal symptoms such as nausea being particularly common. If you're starting Ozempic or have recently begun treatment, you might be wondering when side effects could appear and what to expect. Let's talk about the timeline. Ozempic is a GLP-1 receptor agonist licensed in the UK for treating type 2 diabetes. Most people experience side effects within the first week of starting treatment or after a dose increase, and this is actually quite normal given how the medication works. The medication starts working within days of your first injection, with peak levels in your bloodstream typically reached within 1 to 3 days. Ozempic works partly by slowing down how quickly your stomach empties food. This is helpful for blood sugar control, but it's also why gastrointestinal side effects tend to show up early. That slowing of gastric emptying is most noticeable after your first dose, then tends to ease as your body adjusts. Nausea is the most commonly reported side effect, typically appearing during that first week of treatment, though the exact timing varies from person to person. Other gastrointestinal symptoms like feeling full quickly, occasional vomiting, or changes in bowel habits can also occur during these initial weeks. Here's something important to understand. Not everyone experiences side effects, and the intensity varies considerably between individuals. Some people sail through with minimal issues, whilst others need more support managing symptoms. The good news is that for most people, these gastrointestinal symptoms improve over 2 to 4 weeks as the body adapts to the medication. This is why Ozempic treatment in the UK follows a gradual dose escalation schedule, starting at a lower dose and slowly increasing. This approach helps minimize both the severity and onset of side effects. Your doctor will typically start you on the lowest dose and increase it gradually over several weeks. This isn't just about convenience, it's a clinically proven strategy to help your body adjust while still getting the therapeutic benefits. Never adjust your dose yourself. Always take Ozempic as directed by your doctor. If you're also taking insulin or a sulfonylurea such as gliclazide, it's important to speak with your healthcare professional, as these medications may need adjusting to reduce the risk of low blood sugar when starting Ozempic. If you're experiencing side effects, there are things you can discuss with your healthcare professional. Eating smaller, more frequent meals rather than large portions can help. Avoiding rich, fatty, or spicy foods during the adjustment period may reduce nausea. Staying well hydrated is important, especially if you're experiencing any vomiting. Let's talk about when you need to seek medical attention. Whilst mild nausea and digestive changes are common and often manageable, some symptoms require prompt medical review. Contact your GP if you experience severe abdominal pain, persistent vomiting that prevents you keeping fluids down, or signs of dehydration such as dizziness, dark urine, or extreme thirst. These could indicate more serious complications that need assessment. NICE, the National Institute for Health and Care Excellence, recommends that GLP-1 therapy like Ozempic should be reviewed at 6 months to assess both how well it's working and how well you're tolerating it. This is a good opportunity to discuss any ongoing concerns with your healthcare team. It's also important to remember that whilst we're focusing on side effects today, Ozempic is prescribed because your doctor believes the benefits for managing your type 2 diabetes outweigh the potential risks. Many people tolerate it well and see improvements in their blood sugar control. Everyone's experience is different, so what matters most is open communication with your healthcare professional about your individual response to treatment. So to recap, most side effects appear within the first week of starting Ozempic or after a dose increase. Gastrointestinal symptoms like nausea are most common and typically improve over 2 to 4 weeks. Gradual dose escalation helps minimize these effects. If you're taking insulin or sulfonylureas, speak to your doctor about adjusting these to reduce low blood sugar risk, and contact your doctor about severe or persistent symptoms. Remember, this information is educational and not a substitute for personalized medical advice. Always speak to your healthcare professional about your specific situation and any concerns about your treatment. Have you experienced side effects with Ozempic? Share your experience in the comments below. And if you found this helpful, please like and subscribe for more evidence-based health information from Bolt Pharmacy.